But first to a universal truth. Leftism destroys everything, even the Hippocratic Oath. Yes, trust in the medical profession. Victoria is a fine example of what happens when the ideological zealotry of the modern left is allowed to run amok with no challenge from a sadly gutless opposition. And it's about to become considerably worse with a permanent race-based voice and treaty. Just imagine how much worse it's going to be with Australia's first treaty legislation passing the Victorian Parliament Thursday night. We already have a form of modern-day apartheid when one of Melbourne's leading public hospitals is prioritising patients in the emergency department based on race rather than purely on medical need, as should be the case each and every single time. Staff at St Vincent's Hospital have been ordered to treat all Indigenous patients within 30 minutes of arrival, regardless of the severity of their condition. In a system with finite resources, that undoubtedly means that cases more deserving of medical attention will be kept waiting as race becomes a chief determinant of who receives care first. Everyone associated with this racist program should feel deep shame. A Herald Sun poll this week shows that 95% of respondents are against St Vincent's discriminatory policy. However, it's a policy as backward and racist as it plainly is that is probably, well, enjoying some support at the hospital, given the wokification, that's a hard word, of medicine. If you speak to any recent medical graduate, they will tell you in deep detail just how corrupted the field has become by toxic identity politics. We've been warned about this for years. Among those ringing the alarm has been leading medic and chairman of Do No Harm, Dr. Stanley Goldfarb, who has warned of the trend of medical schools and academics prioritising Wokism and social justice over science. And he says it will do untold damage to the profession. He said elite medical schools are deliberately recruiting woke activists, jeopardising their mission of training physicians. Many medical schools explicitly ask applicants if they agree with statements about racial politics. And it doesn't stop at race, with students expected to embrace all sorts of other woke absurdities like 150 genders. The same trends are sadly evident in Australia. At St Vincent's, the spokesperson claims the policy is necessary and does not compromise care for non-Indigenous patients. They said that research conducted in St Vincent's Hospital, Melbourne's ED, showed First Nations patients were on average waiting longer to be seen compared to non-Indigenous patients. Well, if that's true, then there are only two possible explanations. Either St Vincent's staff are hopeless racists, or perhaps the more likely explanation is that some Indigenous patients are presenting with less serious cases requiring longer wait times. Our public health care should be built on fairness and equality, not equity and race-based privilege. As leading doctor and former president of the Royal Australasian College of Physicians, Professor John Wilson, explained, St Vincent's race-based directive not only contradicts medical codes of conduct, but also the Declaration of Geneva, because it prioritises race over clinical need in healthcare. Now, the PM's office has been asked to investigate whether this policy complies with Commonwealth anti-discrimination laws, as well as Australia's international commitments to non-discrimination in healthcare. The policy may also be breaching state obligations under the National Health Reform Agreement. Call me jaded, but I'm not waiting with bated breath for Anthony Albanese to do anything about this travesty, because this is the modern left, folks. This sort of race obsession and race privilege is a feature, not a bug. And talking about unhealthy race obsessions, let's end this segment with an important message from Senator Lydia Thorpe, whose family plays a not insignificant role in Victoria's Indigenous voice body. Take it away, Senator.
Oh, it's a scary day today in the colony, and yep, it's a scary black woman. I think it's time to go feed the trolls. Let's start with this one. Australia is a racist colony. Here we go, trolls. White Australia has a black history. Trolls. Remember this one? Not my king. Here we go, trolls. Eat that one.